Hey everyone, welcome back to Crystal Vision Therapy. Of course, I am your host, Deisha Robinson. I am excited today because it is May and May is Mental Health Awareness Month. I don't really keep up with these months, but there are a few. This is one of them that I love. I really wanted to kind of get into how do we access therapy. Therapy is very expensive, as we know. If you do not have insurance, on average, you could be paying $200 per session. Sessions usually happen every week. How do you have an extra $800, right, to dedicate to this? If you can do it, perfect. Some people do budget really well. They really prioritize it. They need it. Some people are able to do it. Not all of us can afford that nugget and kind of are left defenseless, right? Fighting for our lives, essentially. So there are ways around that. So we're going to talk about that today. I'm going to give you guys the tea. I'm going to give the juice. And I really hope that this video is helpful for you. Mental health is covered on most insurances now, which is a great thing. And so the first thing you can do is call, let's say your insurance provider is Aetna. Call Aetna. Hey, I would love a list of participating therapists in my area. They can send you a list. You can look them up and you can kind of figure out who you would like based on that. The copay generally ranges anywhere from $10 to $50 per session, which is much better than $200 per session. Check with your insurance to make sure that to see if you're covered and at what percent. So that was the easy part. Now, what to do about the folks that do not have insurance, right? That's a big bucket of people where they don't really have insurance. What do you do? Or mental health benefits. Number one is group therapy. Do not sleep on group therapy, y'all. Do not do that. Group therapy is dope if you have a skill that you want to hone in on. Like there's a lot of parenting groups, there's divorce groups, and you need the support of your people to kind of get through. You need the support of your environment. Group therapy sessions range anywhere from, it could be $40 to $70, which again is much more affordable than if you were without insurance having to see a provider. So I would encourage you to get on a couple of sites that can show you where your group therapies are in the area. So Psychology Today, everyone knows like the GOAT, right? Of where we kind of go for everything, articles, finding people, things like that. So you can go to support groups and see all the groups that are in your area and how much it costs. Also in group therapy, there are mental health clinics, right, that will offer, I remember I went to Hofstra for my master's degree and we used to run a group called Confident Kids and it was $15 per session. Now I'm sure inflation is probably up to about $25, but $15 a session, you can't beat that. For some therapy is great. Although they're students, right, so they're learning. You get the benefit of they're working with an experienced professor, they're working with an experienced clinician, so they will always kind of have that backup. But if you need something, it's a great way to start. I want to shout out our sliding scale providers. What's a sliding scale? So sliding scale is, let's say therapy services are $150, they say, but I offer a sliding scale. You may be able to talk to the therapist and say, hey, like I'm hardship, what can you offer? And they may say, yes, I offer a sliding scale. So I can take this down. This $150 will now become $70 per session because of your hardship. So there are a lot of clinicians that do sliding scale. I was on Psychology Today scrolling. Sliding scale available, yes. Sliding scale available, yes. So even if you don't see that they accept sliding scale, ask, hey, I'm on a budget. This is what I can afford to pay. Is this acceptable? We know that we kind of entered a service field. We know that it's not accessible. And I think a lot of us try to do the best that we can, but of course, trying to maintain a living. So I have heard of some of my colleagues who would do sessions for $50 a session, right? Just for the person to receive services. So do not be afraid to ask. It is a valid question, and we understand the question. So don't feel awkward about that. That's something to feel awkward about. We get it. We get it. Each school where they do teach mental health, right? They may have centers dedicated. And when they have that, they will have deeply discounted sessions because the therapists that you're getting are still learning, and they need the experience, but also want to service the community, right, at the same time. And so whatever master's program is in your area, see if they have a counseling center and see if they accept patients. Those will be deeply discounted. They do not take insurance. It's strictly about getting the experience. How it benefits you is sometimes or sometimes you may be asked to be on camera, like for the session to be recorded. Of course, for the clinician to be better, to learn where he, she, or they may have messed up or could be stronger here, or where they did a good job. So you will always have multiple eyes on you, right? And what I loved about working in the center was that I can say, hey, like, I really think this child in my family session would benefit from an arts therapist. Boom, the art therapist was right there in the same center, right? Because it's a center for counseling services. So it was much more connected, right? Because it's an academic institution. So yes, are you getting a therapist that's learning, trying to get their foot in the door? Of course, but that's when I felt like I was the most motivated. I was the most daring, because I was starting out and I wanted to make change. That's when I was studying every day and really thinking about my clients deeply. So don't be discouraged by that. There are some older therapists that may have been doing it for 25, 30 years that maybe don't have that passion that you would get from a newer therapist. And again, they are not doing it on their own. There's going to be a class with them to give them pointers, and also there is the professor, which is always usually a clinician. So do not sleep on these services. When I was in my center at Hofstra, I believe we charged, I think it was $35 a session. Listen, y'all can't beat that. Maybe inflation, maybe it's about 40. You cannot beat that. If you go twice a month, or I think it's a great way to get some help. YouTube is free. You're watching me on YouTube right now. You didn't pay any money. There are amazing mental health providers on here talking through what you need. If you put in mental health services and, anxiety, it's thousands upon thousands of videos will come up. Sure, you never know. Everyone has a different quality. Everyone has a kind of a different message, but you can kind of go through and see what resonates with you. And the best part is that it's free. Connect with a Facebook community. Those are free too, right? Plenty of mental health providers also have free Facebook groups that they're giving kind of free gems away, right? Because we understand that we're offering a service to the community. So we want to make sure that we give as much as we can, because we know this is a hot topic and this is needed. So make it kind of like what they tell you about exercise, like make it a part of your life. Mental health is something that you need right now. Make it a part of your life. Join the Facebook group, subscribe to some therapy YouTube, so that when they post a new video, you get it, you watch it, you kind of get your dose for the week. So use social media for good. I think we're at 5. I'll be sorry. I start to count and then I stop counting. Yeah. So 5 is tried and true. The self-help books, they're like the OGs, right, in the game. Self-help books are amazing. They do delve deep. It's hard because, of course, it's not going to be so concentrated on you, but it's specialized enough where you definitely can get some from it. This is where I stand for some life coaches that really are giving great teachings. I stand for the Brene Browns of the world, the Esther Perels of the world. They are writing great books that are helping millions of people. So do not sleep on self-help. Go to Barnes and Nobles, go to the self-help section, and just look to see whatever you feel like your affliction is, there's a book for it. And the books are relatively inexpensive, $15, $23 sometimes. And I think the messaging in it and the behavior that they address could be life-changing for you. So read a book, tried and true, old method, 10 out of 10. Lastly, I want to talk about understanding the benefits that your job offers. I can't tell you how many times I think, we get a little benefits package. We're like, okay, do I have insurance? Check. You know, do I have holidays, vacation days? Check. But there's so much more to your benefits package than just that. And something that is common now, especially with mental health being such, you know, an area of expertise that's needed, is the Employee Assistance Program, EAP, right? So, you know, probably different companies call it different things. But EAP, yes, you do. EAP often, you know, lets employees that are in need have a few free therapy sessions. Some are great, some will give you 10, some will give you 5, and then refer you on to someone that they think can help you. And they're typically for free. Those are typically covered. What's nice is if you get 5 sessions, you know, it can kind of get you out of a crisis. That's the idea, right? It's kind of like crisis management. It kind of gets you out of a crisis. And it's some help, right? The idea is some is better than none. Of course, we want you to kind of continue the journey, but I understand cost is an issue, but 5 sessions get you started. The therapist may give you a book. You can ask for a book. You can ask how do I extend this if I can't afford this moving forward, and they should be able to answer those questions. So understand what your job offers in terms of mental health services. You might be surprised. There's a lot of people that are surprised. Go to the mental health workshops that they have. A lot of companies now are doing that, where they will have mindfulness, breathing. Like, it's amazing kind of how people really have kind of stepped up when it comes to providing certain services. Is it 100%? No, but it's a start. It's definitely a start. So thanks guys for watching. I really hope that was helpful. Wanted to shed light on Mental Health Awareness Month and make sure we can access therapy because it's so important for us, and everything I feel like that we're going through. So I hope you have a great day. Thank you for subscribing. Thank you for listening, and thank you for allowing me to kind of get better. Right? This is a whole different ball game. Kind of putting yourself on a platform, recording, editing, and figuring out, and I feel like I'm grateful to just be able to do this. So thanks so much. Take care. Bye.